Check the scene and the injured or ill person.
Are you okay? Are you okay?
After checking the person, tell someone to call 911 and get the AED.
You, go call 911. You, go get the AED.
Check for breathing for more than 10 seconds. If no breathing occurs, begin compression.
1, 2, 3, 4, 5, 6,
Perform 30
7,
compressions
8,
and then
9,
afterwards check for
11,
breathing and
12,
give 2 rescue
13,
breaths.
14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
When using the AED, simply press the start button and listen to the instructions given and follow the instructions carefully.
This is a training device only. No shock will be delivered. Remove clothing from person's chest. Attach pads firmly to person's chest as shown.
When placing pads, you want to make sure that one is on the upper right end and the lower left end of the
Check
person.
connector and pads. Analyzing rhythm. Everyone stand clear. Shock advised. Charging. Everyone stand clear. Everyone stand clear. 5 cycles of CPR.
After checking the scene and the injured or ill person, have someone call 911 and get consent. First, bend the person forward at the waist and give 5 back blows between the shoulder blades with the heel of one hand. Place a fist with the thumb side against the middle of the person's abdomen, just above the navel. Cover your fist with your hand. Give 5 quick upward abdominal thrusts. Continue sets of 5 back blows and 5 abdominal thrusts until the object is forced out. Person can cough forcefully or breathe. Person becomes unconscious.
Remove articles of clothing blocking wound and clean out with warm water. After, apply gauze and pressure.
Motivation is an internal state or condition, need or desire that serves to activate or energize behavior and give it direction.
You can make this mile in 5 minutes. I'll give you a whole box of donuts, man. Yeah, you got this. You got this.
Goal setting is identifying clearly defined specific objectives that are measurable. A short-term goals are specific outcomes to be reached within a set period of time, a day, a week, a month, or perhaps even a few months.
So you can hit the 630 on the out pretty consistently, but I think you just try to push a little harder for the next 2 weeks and hit like a 620.
Long-term goals are those that one strive to reach in more distant future.
So this year you did really well for us to get the images a little better than the preseason. Next year, you're going to nail it.
Imagery is the process of reviewing and training in the mind only using visualization.
So I know you want to hit that bench PR at max. I want you to imagine in your head you got the sticking point. I want you to visualize what it's like to push through that sticking point and get it to the top and get that final rep.
Simulation is the process of making physical training circumstances as close to possible to real competition. Stress is some factor that causes awareness, anxiety, focus, or fear. Stress can be either good or bad and have both positive and negative effects.
The highest blood pressure in the heart is the systolic number, which correlates to the ventricular contraction. The diastolic number, however, is the lowest pressure in the heart and relates to ventricular relaxation. Shock is a potentially fatal physiological reaction usually characterized by significant drop in blood pressure, reduced blood circulation, and inadequate blood flow to the tissues. May occur in response to several conditions, including illness, injury, hemorrhage, and dehydration. The general signs and symptoms of shock are restlessness and anxiety, weak and rapid pulse, cold, clammy skin, profuse sweating, a face that becomes pale, shallow respirations, dull, lustrous eyes with dilated pupils, thirst, nausea and vomiting, blood pressure that falls gradually and steadily, and loss of consciousness. Go. A gauze dressing is a woven, flexible, absorbent cloth applied to a wound. Find your target heart rate for 6 seconds. 1, 2, 3, 4, 5, 6. What's your heart rate?
16.
Perfect. You're in your target heart rate zone. You are.
Stretching is moving the joints beyond the normal range of motion. Static stretching is a gradual, slow stretching of the muscle through the entire range of motion, then holding the position for 20 to 30 seconds. Ballistic stretching is a rhythmical bouncing action that stretches the muscles a little further each time. Rehabilitation is trying to prevent injuries before they occur through a preventative management program. This is what happens when you do not use rehabilitation. Run a mile. This is what happens when you do use rehabilitation. Run 50 miles. Cardiorespiratory conditioning is an activity that puts an increased demand on the lungs, heart, and other body systems, also known as aerobic and endurance training. Hypertrophy is an increase in the size of muscle tissue. Atrophy is the weakness and wasting away of muscle tissue. Primary injury survey is the assessment of life-threatening emergencies and management of airway, breathing, and circulation. EMS should be activated when threats to life are suspected.
Hey, call 911.
Airway, breathing, circulation. A secondary injury survey is a thorough, methodical evaluation of an athlete's overall health to reveal additional injuries beyond the initial injury. HOPS is an acronym for the approach to the secondary injury survey: history, observation, palpation, and special tests. H stands for history.
So what happened? What'd you hurt?
I hurt my gastrocnemius while running a mile.
Oh, joy. Do it. When did you do that?
Probably 5 or 10 minutes ago.
That's pretty fresh, huh?
What was the position of the body part in the injured area at the time of the injury?
My foot was dorsiflexed.
Was the weight bearing or non-weight bearing?
Bearing.
Activity at the time:
Running.
collision or contact?
Contact.
What was the speed?
Approximately 15 miles per hour.
What was the direction of force?
Forward.
Intensity and duration of force?
Approximately 1 second. Very intense.
Was there any twisting, hyperextension, hyperflexion?
Hyperflexion.
Was it sound heard?
No.
Where is the pain now?
In my gastrocnemius.
Where was it?
In my gastrocnemius.
Point where the pain is. On a 1 to 10 scale, what is your pain now?
6.
Is your neurological function intact? Is there any numbness?
It's not intact.
Is there any instability?
Yes.
Can you walk?
No.
Is there any prior history to this?
No.
O stands for observation. Observation is looking at the injured side compared to the uninjured side. Palpation is touching during examination to determine the extent of the injury. Special tests and examinations may be necessary to establish the degree of the injury. Diagnosis is using information from assessment and physical examination findings to establish the cause and nature of the athlete's injury or disease, made only by a physician or other licensed healthcare provider.
Hold your gastrocnemius, sir. So, what's your height?
About 5'6".
5'6". All right. What's your weight at?
About 125.
All right. What's your build status right now?
Tiny.
Male. What's your strength level?
Very strong.
Very strong. Of course. What's your? Are you a high school athlete?
High school.
High school.